Hello, everyone. My name is Tabitha Bird, and I am an RN who works in long-term care. This is my senior practicum presentation for Nursing 456 at ECPI University as part of the completion of my BSN degree. The topic of my project was preventing medication errors. Over the last 6 months, the facility I work at has had an increase in the number of medication errors by multiple nurses. The goal of this project was to determine any commonalities with the errors and develop a re-education program for the staff, including evidence-based practice, with the goal of preventing future errors. The first thing that was done was to sit with my mentor and look at all of the incident reports relating to medication errors, which included one transcription error, and the others were related to either not reading orders fully or not comparing controlled medications with the EMR or narcotic sheet. These specific errors did not result in giving the wrong resident the wrong medication, thankfully. Just pulling it from the wrong bottle, resulting in a narcotic discrepancy, since some of our hospice residents have both routine and PRN medications with separate bottles for each order. Input was requested from the nurses on what they thought caused the errors and how comfortable they felt with using the EMR at the facility, along with what would improve their medication administration. Using all of this information, along with evidence-based practice and the facility policy, a training program was developed. There were multiple steps necessary to achieve the goal of this project. Before the objectives could be clearly identified, as mentioned earlier, an initial questionnaire went out to the nurses, consisting of 7 questions asking them how comfortable they were using the EMR, what they thought were contributing factors to the recent medication errors, and ways to prevent them. Using their feedback, along with the identified causes of the actual medication errors, the objectives were written and a lesson plan was developed. My mentor added suggestions on items to include that were facility specific, like the pharmacy delivery policy. After the education was provided, the goal was to sit with each nurse using the EMR's training database to review what they had learned. Unfortunately, the database was not working, so I actually completed medication observations with the nurses in the household, which gave me the opportunity to give feedback to ensure they had the necessary skills and knowledge to reduce the incidence of medication errors with my supervision. After reviewing the literature related to medication errors, it was discovered that the main evidence-based practice remains the 5 rights of medication administration. So this became my first objective to retrain the staff on the importance of them. In nursing school, it is common to receive instruction on the 5 rights as the basis for patient safety, and it has been expanded by some to include additional rights. My facility actually has it written in the policy to utilize 7 of those rights. So that was included in the training along with the main 5. The EMR used in our facility had some training videos that I had discovered showing different functions of the EMR that would assist with the streamlining of the medication administration process that I was able to demonstrate to the staff as my second objective. And finally, the third objective was coming up with a way to reduce interruptions during medication pastimes, which can include alerts from call bells, phone calls, and other team member conversations. Since the training was being offered in person and via Zoom for the nurses who work off hours and do not live near the facility, I developed a presentation that could be used again by anyone else in the facility for future training by including speaker's notes in the PowerPoint. The nurses were shown how to locate the facility policy when they were at work, and the pharmacy medication delivery policy was provided to each nurse at the mentor's request. A quiz was given after the presentation that included 6 multiple choice questions, and overall, the nurses answered them correctly. But I did notice the common issue of not reading the questions fully, which is similar to what we discovered with reading orders. One question specifically asked what right was important after administering medication, and a couple of the nurses had selected multiple answers instead of the correct one. Before the training, a few photos were taken on the unit to use as examples of what not to do during medication administration, and a live demonstration of using the EMR was conducted at the end of the presentation, which allowed the nurses to ask questions. An in-depth explanation of the 5 rights was given during the presentation, including the importance of ensuring specific medications are given in a time window. The example provided was from an article from the Journal of Pharmacy Practice written by Furnish et al., where they pointed out that a delay of an hour can result in a patient with Parkinson's disease developing tremors, agitation, confusion, and gait instability. Using that example, along with the importance of ensuring the right dose is given, since an error as small as moving a decimal place can change the dose of a medication by tenfold, giving them 10 milligrams instead of 1 milligram. The nurses could get a better picture of how important the task of administering medications really is. The two rights that were added were encouraging the nurses to know the right effect and to use the right documentation. The photos here were used to get the nurses to identify what was wrong, and they were all quick to point out how the medications were just sitting on a counter and how the medication server was not secured. The EMR was open and pills were sitting out with no nurse around. These examples were great ways of discussing the importance of closing doors when passing medications to limit distractions as well as secure medications. Based on the feedback from the initial questionnaires, the top 3 reasons that were felt to be contributing to the medication errors were not reading the order fully, distractions and interruptions during the medication pass, and passing medications by memory, including not having the tablet in the medication room. These areas were addressed in the training, and the tips were given to let their team know when they were going into the med room to pull a controlled drug and then leave their radio and phone outside on the desk. Close the bedroom door when entering a room to administer medications, and reading the orders fully and compare the EMR with each medication. Finally, use the filters in the EMR to alert them who needs vital signs before giving them their medications. The overall feedback that has been received from the nurses has actually been positive. They have all begun to use the advanced filters in the EMR as part of their normal practice with medication administration. There was one nurse specifically who is receiving additional training due to the most recent medication error that was made, and they are making sure to call and get orders clarified and getting a second nurse to verify controlled drugs when necessary. The act of closing the doors and not leaving medications sitting out unsecured are both ongoing issues and are being corrected as needed. The nurses do require reminders that medication administration is the most frequent task we undertake as nurses, and an error can cause preventable resident harm and increase costs to already strained healthcare budgets. Medication errors can happen and are a global concern, with 5% being deadly and close to 50% of those being preventable. In the US alone, approximately 7,000 to 9,000 patient deaths can be attributed to medication errors, and we as nurses are the ones who have the ethical and legal commitment to improving the medication management process by not only ensuring errors are reported, but also doing our best to prevent them. By having a basic understanding of a drug's physiology, we know what effects to look for after giving a medication. If you are unaware of the effects of a drug, you should use all available resources to learn them, which can include the physician or the pharmacy. As technology is becoming more common in healthcare, we need to remember that humans enter the orders, and users often become complacent with the thought that the technology will identify any errors. So limiting interruptions while entering orders and pulling medications is necessary for us to be able to reduce those errors. It is our task as nurses to make sure that we maintain the safety of those we care for, and they depend on us to know what medications we are giving them as well as why they are getting them. Reading orders clearly, questioning anything that does not look correct, comparing labels with the EMR, and limiting distractions while pulling controlled medications is something we can all take the time to do. I feel lucky to have been able to work with the mentor I had here at my facility, and by doing this project, I myself learned some important information to use while administering medications. I am hoping that with the help of my mentor, we can identify a few nurses to become champions for the rest of their team and become mentors to them and any future nurses. If you want to see more information about medication errors in healthcare, you can look at any of these reference sources. And I want to thank you today for taking the time to watch this presentation.